Hi, my name is Amy Drury. I'm here to talk to you about poor nurse-to-patient ratios, which means how many patients one nurse is caring for at any given time. In particular on the units at the hospital, on the floors, such as the medical unit, the surgical unit, preoperative, postoperative, etc. So the poor staffing of nurses in healthcare is a huge and widely known issue right now due to the current global pandemic. What you probably don't know is that this has been an issue for a long time. This didn't just start this year. I'm sure you'd be surprised to know that according to the European Journal of Cardiovascular Nursing, the risk of patient mortality can increase by more than 14% when the unit is not adequately staffed. So if you have one nurse taking care of, say, 8 patients, your risk goes way up of mortality as a patient. You should care about nurse-to-patient ratios because it can affect you or someone you love in a very negative way, and their life can literally depend on it. I can speak to you about this topic today because I am a nurse myself. I am personally experienced with outcomes of poor nurse-to-patient ratios, both firsthand and witnessed, unfortunately. Poor regulation or lack thereof of nurse-patient ratios in healthcare facilities can cause physical harm to patients and poor outcomes, as well as mental and physical strain of the nursing staff. Today I will discuss the poor nurse-to-patient ratios, the causes, the effects, and some possible solutions. But before we start, I'd like to actually share a quote that I found that I really liked. It's from Dr. Thomas Lewis. I found it in an article on a law review website that spoke about why there should be federal mandates for nurse-to-patient ratios. So Dr. Lewis says, "My discovery is that the institution is held together, glued together, and able to function as an organism by a nurse and nobody else. They spot errors before errors can be launched. They know everything written on the chart. Most important of all, they know their patient as unique human beings, and because of this knowledge, they are quick to assess apprehensions and act on them." I really like that. So first, I will discuss the root of the problem. So causes. So one of the causes of the nursing or poor nurse-to-patient ratios is nursing shortage. Like I said before, this is something that's been going on for a long time, not just when the pandemic hit. So this has been an ongoing problem. And actually, the average age of a nurse is only 50 years old. I was surprised by that. And I know that most of the nurses I work with are older than I am. I'm 37, and the majority of nurses that I work with are older than me. 55% of working nurses are over the age of 50. And I found this in an article in the Gale Encyclopedia of Nursing in 2015 is when this was written. So this means that more than half of the nursing population is up for retirement. That's kind of scary. And due to the current pandemic, many of these nurses have elected to take early retirement. Many of these nurses that I know that I have worked with have retired early because of the working conditions that we have now due to the pandemic. Another cause is what we call going lean at the hospital. They're always trying to find ways to skimp by, ways to, for things to cost less money, but to do more. So doing more with less in healthcare, and that is very risky. I've seen it everywhere that I've worked as a nurse. So healthcare facility cutbacks are an attempt to save money, but they have crippled the staff and make room for errors. So now that I've discussed some causes, I will discuss some of the effects that this has on patients and nurses. So physical harm and poor patient outcomes, such as mortality. Like I spoke about earlier, your chances of dying are 14% greater when there's a lack of staff. So if you look at it this way, you have less risk of dying during surgery than you do being taken care of postoperatively in the PACU or post-anesthesia care unit if they're poorly staffed. Another thing is chronic problems for the patients. If there should be an event that occurs because of lack of staff, such as a patient fall, the nurse can't be in 12 rooms at once, so if you're helping a patient to the restroom, and you hear an alarm go off, meaning that a patient has gotten out of bed without help, you can't just leave the patient you're helping at the moment to run to that other patient's room. So by the time you get them to the restroom or to their bed, you go to the other room where the alarm is going off. That patient's already in the floor. They've hit their head. There might be a head bleed. They might have broken a bone. So because of this, if they broke their hip, they need surgery, they're bedridden. This develops into pneumonia because they're bedridden. And the elderly have a much harder time recovering from these types of things. So it causes lots of problems. Also, medication errors. You give too much insulin, you're in a hurry, you don't double check it. You give too much, this can obviously kill a patient and cause long-term side effects if they are left unharmed. And then mental and physical health of nurses, burnout, that's a big one. I've gone through it myself and currently as well. This causes big rates of turnover in the nursing workforce. I've seen this a lot. Especially right now, we have lost so many nurses and other healthcare staff due to the pandemic for multiple reasons. Skipping lunch and bathroom breaks. This can cause exhaustion as well as urinary tract infections for nurses. Skipping lunches is big because if you don't take a break at all, you're working 12 to 16 hours a day. That's a big deal. Long hours and overtime. I've been affected by this myself. The long hours and overtime have caused me to be so exhausted that when I come home after a very long shift, sometimes I get home and I don't remember driving home because that's how tired I was. And I watched something on Mythbusters not long ago. I don't know if you know that show, where they were comparing if it was more risky to drive drunk or to drive exhausted without any sleep. And they found that it was more risky to drive tired than it was to drive drunk. I thought that was interesting. I'm not saying that you should drive drunk, but I'm just saying that's how big a deal it is. So now that I've discussed the effects, I will talk about some possible solutions. Obviously, government stepping in is a big deal. And California is the only state with mandates, and that seems insane to me. One state out of 50 has mandates for nurse-to-patient ratios. Incentivizing healthcare systems. So one way you can do that to incentivize to provide better staffing is to give out fines for poor staffing. And they would obviously have to track that. And then quality care metrics and software. I found a couple of things. According to an article in the Journal of Neuroscience Nursing, using quality of care metrics to collect data on nurse-sensitive patient outcomes can actually help persuade healthcare system to improve the staffing situation. If you really show light on it, give proof, and then that could persuade them to do so. According to an article in Nursing Economics, it was suggested that we need to use technology to create a software that would help with patient assignments by pairing individual nurses with patients based on the nurse skill level and the patient's acuity level, meaning if they're a high-risk or low-risk patient. This would at least help cut down on poor outcomes when staffing is low. So this would not solve the problem of not having enough staff, but it would at least spread out the acuity level of patients with nurses that are able to take care of them. So in conclusion, the poor nurse-to-patient ratios have devastating effects on patients and nurses alike. This needs to be addressed to prevent further damage. So in this speech, I argued that the lack of regulation and improvement of nurse-to-patient ratios causes harm to patients and nurses. Today I discussed causes and effects of the poor nurse-to-patient ratios and also possible solutions to improve the problem. You should be concerned that one of your loved ones might become one of the statistics that stem from poorly regulated ratios. You can do your part by writing or calling your state government officials about your concerns. And thank you for watching.